Hello, this is Mark Silver. I'm continuing with the program on borderline personality disorders. And in this part, we're examining the chief criteria of BPD from the DSM-5. And the next category that we're looking at is self-damaging impulsivity. Impulsivity, a cousin of disinhibition, I believe, is rapid, unplanned, or poorly planned decisions without concern for the immediate or long-term consequences of the behavior, which may cause potential or real harm, including irresponsible spending, unhealthy sexual encounters, substance abuse, reckless driving, binge eating, among others. Impulsivity is not so much about an uncontrolled appetite, but rather a knee-jerk reaction. However, it is wrong to think that the borderline's impulsivity is behavior-driven alone, as it is almost certainly almost cognitive in origin. That is, the borderline's impulsivity is driven by impulsive racing or even incoherent thoughts that can only be satisfied through the impulsive behavior. While the behavior may or may not satisfy a particular feeling or need, it is often part of an ongoing pattern of behavior. While we generally want children to be endlessly curious, even impulsive, to discover the world, experimenting with behavior, emotion, and thinking, borderlines, as adults, must learn to show restraint in these areas. While kids are time blind and sometimes obligation blind, adults have commitments, deadlines, and time-sensitive duties. I would distinguish the impulsivity that borderlines exhibit from impulsivity noted in persons with attention deficit hyperactivity disorder in various ways. While borderline impulsivity is related to emotional dysregulation, ADHD impulsivity is a neurological dysfunction and behaviorally driven without being qualified necessarily by anxiety or emotional dysregulation as such. It also seems that the impulsivity in ADHD is generally less dangerous or risky, although this is not always true. Additionally, there is a strong tendency for most children to grow out of impulsive behaviors, while adults with BPD tend to exhibit impulsive behaviors in a somewhat consistent pattern throughout adulthood. Impulsivity may lead the borderline to live on the edge, engaging in dangerous behavior, sometimes even to the exclusion of healthy endeavors. In fact, impulsive behavior can take on a life of its own and become a discrete issue or pathology with far-reaching negative consequences for the borderline. For example, at some point, frequent impulsive gambling becomes indistinguishable from a gambling compulsion, just as chronic insomnia due to depression may need to be understood as a sleep disorder at some point. Although rock climbing has a high incidence of mortality, it is wrong to assume that most rock climbers are borderlines or that rock climbers are impulsive by nature. To the contrary, endeavors such as rock climbing require considerable preparation, and each move must be considered in a careful manner for the individual to remain safe. Although impulsive behavior may be high risk and dangerous, it nonetheless tends to allow the borderline to enjoy solace in a way that normal, healthy endeavors usually do not, as it tends to reduce his sense of emptiness, boredom, and even psychological pain. It is not clear if the solace is produced through the behavior itself or by the end result. That is, does an impulsive sexual act satisfy the borderline because of the sexual encounter, that is, the nitty-gritty of the interaction, or because of the satisfaction gained from the outcome, that is, the orgasm or similar result? This leads to a puzzling question. If the borderline engages in healthy and safe activities, such as hobbies, that bring enjoyment, solace, and a personal sense of accomplishment, then why would the borderline also need to engage in impulsive, high-risk activities that jeopardize his safety and which may ultimately negate his ability to engage in enjoyable, healthy, and safe activities? Part of the answer lies in the recurrent destructive, and even suicidal nature of the borderline's personality, which we will look at in the next video.